The Rajiv Gandhi Cancer Institute and Research Centre in Delhi, India is one of the largest tertiary cancer care centres in South Asia.
Our vision is basically to serve poor people at international standard and at an affordable cost with ethics and values. We have the medicine department, we have the surgical department, we have the radiation, then we have the support services in terms of lab, in terms of imaging, in terms of nuclear medicine. Those are 250,000 footfalls every year, about 23 to 24,000 admissions every year. And we have a very efficient team of doctors, about 200 doctors and all, about 600 nurses, we have about 300 technicians.
The Uro-Oncology department in Rajiv Gandhi Cancer Hospital leads in doing complicated robotic surgery like in post-chemotherapy retroperitoneal lymph node dissection and robot-assisted groin dissection for CA penis. The retroperitoneal lymph node dissection post-chemotherapy has a lot of technical difficulties even in the open surgery, but we have done maximum number of such cases in the world. The groin dissection, is a morbid operation if you do open, but if you do with robotic, the morbidity decreases. And we are number one in the world probably because the incidence of CA penis is very high in our country, and we do get a lot of cases.
All patients are offered international standards of treatment and care.
क्योंकि यहाँ पर राजीव गांधी हॉस्पिटल में सारी चीज़ें एक ही छत के नीचे उपलब्ध हैं, बायोप्सी और सारी चीज़ें इसकी है, इस वजह से जो है कि कहीं और नहीं किसी के असिस्टेंट पड़े, इसलिए यहाँ पर चूज़ किया था.
The robotic surgery, there was no major cut, no major incision, no loss of blood, but the recovery was much faster. There was not a moment's pain or any agony or any distress of any kind. It was a very good post-operative care taken for me. I had the fullest of support of the people here. I very proudly go and keep shouting everywhere, I'm a cancer survivor. Look at me, don't get scared of cancer.
From its inception, the Rajiv Gandhi Cancer Institute and Research Centre has had an integrated research programme in basic and clinical research.
The department has published two original techniques. One is going to get published. One was pitcher spot ileum neobladder, and this is a technique where we make new bladder after removing the urinary bladder for cancer, and it was modification of existing bladder which was a Studer's bladder, and by this technique the bladder reaches to the urethra where we remove the original bladder. This technique I am doing since 2005. And we have done more than maybe 1,000 cases. Now we are working on the long-term results of the same technique. The second thing which we published was mini-lap cystoprostatectomy. This is removing the bladder with a small incision. So we started reducing the incision, which reduces the morbidity also of the patient. The third technique which we are working on now is the tube-in-tube technique of joining ureter with the intestine. We have done enough number of patients, now we are just waiting for the long-term results. Basic research, we had been many collaboration with the ICPO and MET University. I worked in Maryland also in a molecular lab in Center for Prostate Disease Research. In Uro-Oncology, we could publish a ERG expression in CA prostate patients from Rajiv Gandhi Cancer Hospital. Those are the only data from India in ERG expression on the prostate cancer. And right now we are working on other projects like maybe prostate cancer genome. The department had been the part of the clinical trials since 2006. We have recruited a lot of patients in these trials. Patient gets benefited because he gets the treatment which is not available in the market, which is free of cost. So we give a care which is not even tertiary, rather a step ahead care which will not be there anywhere in the country.
At the forefront is the technology, and today we have two robotics, various other instruments which are state-of-the-art, be it in radiation or nuclear medicine or PET scan. And in addition, I think the core of in the cancer especially is the diagnosis. We have a state-of-the-art molecular lab which is one of the best in the country, and through that we are able to diagnose quickly and efficiently and correctly, because diagnosis in the cancer is the key. Then we have a tissue bank which is again unique to the institutions, and through the tissue banks we are able to do a lot of research, and we are able to disseminate this to others also for doing research. We do a lot of preventive free screening of the patient, do about 10,000 screenings every year. And then we find about 3 to 4% are either the pre-cancer stage or the cancer stage. These people are helped by the institute. And in addition, we have a home care unit which goes to all the patients who are at the end of their life, palliative care basically. And in addition, we do a lot of philanthropic work from the hospital because we are no profit organization. We spend about $1.5 million every year on philanthropic work, giving free bed to a patient or giving some concession in the medicines. It goes a long way, especially in the country like ours where people are poor.